Hi there, Tracy from Kazadans Equestrian, and welcome to this week's video. The most common reason that horses are unable to perform their job for us is actually lameness. So in this week's video, I'm going to start on a series of a few videos on helping you identify your own horse's lameness and maybe recognise earlier rather than later to minimise the risk of this lameness developing into something that's quite serious. Before I head on with the topic, please, if this is your first time to the channel, then welcome. Make sure you have a look around. I've got plenty of health videos there. And if you like the look of it, make sure you subscribe to the channel, and I'd love you to share my videos around as well. So what is lameness and how do we define it? Well, lameness is really the alteration of a horse's normal gait. So anyway, the horse is not walking symmetrically or normally or rhythmically is a lameness. The main reason I want to do this video is sadly most people seem to have to wait until somebody else says your horse is lame or your horse is obviously lame. You get on it and you notice it's obviously dragging or dropping a leg. And prior to this, there are often many signals of a horse trying to tell you that it is lame before it gets this serious. And we know that the earlier there is intervention to a lameness, the better the prognosis, the more likely it is that your horse is going to be able to get back to 100% sound, and the shorter time off of work that you will have, the earlier you address these lameness issues. I've seen many a horse being ridden and to me and my eye quite obviously lame, but the owners sadly aren't able to see that. So I'm wondering if we work through this and enable you to develop some of an eye for your own horse at the very least, or an awareness of the points to look at in the horse, and maybe just every 4 to 6 weeks make sure you do a bit of a check of your horse and see if there's any of those small things progressing that we can catch really early. So firstly, before I even go on with the rest, I'm going to set you something to do, I guess as some homework, prior to watching any of my videos after this one, because I am going to help you get your eye in and have a look at your horse's gait. And one of the ways that I use to look at horses' gaits and their lameness is actually utilizing my slow-mo video on my phone. This is really fantastic. You can have a horse walking out and back, and by your eyes you might be looking at it saying it's perfectly straight, and then you look back on the slow-mo and notice that the arc of one leg is completely different to the other one. This is a lameness. So if you can, get either somebody else to video you or vice versa, and get a slow-mo video of your horse walking directly straight out and back and from either side. And once you've got those, when we go through the next videos, you'll be able to go back and look for specific things in your horse and see if you can eyeball any potential or lameness issues. A horse changes its gait and changes its movement to avoid pain, normally a pain around a joint. So the horse's lameness isn't in direct response to the pain, it's actually in direct response to them avoiding the pain. And sometimes that's really important to have in your mind when you're watching your horse. What is it that your horse is avoiding doing? Now, changes in gait are not necessarily only coming from the legs either. We need to be aware that these changes in gaits can happen in the head, the neck, and the body as well, and even the tail. A horse that's suddenly carrying its tail to one side without any other show of lameness is highly likely highlighting to you that something is going on. Any shift of the head, let's bear in mind that a Normal horse's head can weigh about 70 kilos, and that's fundamental in shifting balance of weight. And sometimes a horse just not wanting to be center with its head is it attempting to avoid pain by shifting more weight onto a different side. So some of the changes that you see with the legs are either a shorter ground phase, a shorter through the air phase, a swing maybe, and sometimes this swing is just them avoiding the bending of one joint. So you won't necessarily see a lameness, you'll just see an avoidance of a particular movement through that limb. Most importantly, a sound horse is symmetrical and it has rhythm. So the walk is 1, 2, 3, 4. The trot is 1, 2. And it should be able to keep at that rhythm. Anytime that there is one leg that's on the ground for longer or less, or something that isn't working symmetrically, the left side somehow looks different to the right, you are dealing with a lame horse. Again, if it's not moving with the same rhythm or regularity, sometimes horses simply don't want to go forward as fluidly or as keenly as they normally would. This too is them trying to present with you a mild lameness. If you do just catch your eye on something that looks slightly different from one side to the other, imagine that you can see through the horse to the skeleton, and I'll help more with this as we go on, and think to yourself, what is the horse here avoiding? Not what is it doing, but what is it avoiding doing? Because when it's avoiding, that's likely to be the point of pain. So get your video done and start recognizing your horse's gait with, like if you live in a stable area, organize a morning and video each other's and watch each other's horses move and see if you can notice anything out of the ordinary, particularly anything non-symmetrical. The more you do this, the more you get your eye in, the more likely you are to see these changes. As we progress through this series of videos, I'm hoping to help you develop a pattern. And once you use this pattern continuously to look at your horse, it will become much easier to identify those mild lamenesses early. And as I said, reduce the risk of anything getting too dramatic too quickly. There are so many different types of lamenesses, and I will discuss these in a little bit more depth later on in the videos, but there are many different types. There are primary and secondary lameness, and these I'll explain a little bit more in this video in a second. There's pain mediated, so a trauma or abscess, it's just literally pain in a foot or leg, and that causes the lameness. So that's just a pain-mediated lameness. There's also biomechanical lameness, and by this I mean it's not necessarily an overt pain, but let's say the horse has a really tight hamstring on one side, then you're going to notice an asymmetric movement and a very short stepping with that hind leg, or maybe that's in both. Okay. That's a biomechanical lameness. There's neurological lamenesses, there's weight-bearing, non-weight-bearing lameness. And some of the worst kind to try and diagnose, intermittent and shifting lamenesses. So difficult, which actually makes it even more important for you to work out your pattern of visualizing and assessing your horse, because you are the one who's going to see this the most. Right, a primary lameness. A primary lameness is one that occurs as a consequence of something happening that is not related to anything else. It would have happened on its own. A horse gets kicked in a leg and it's got trauma, pain in that leg, and is lame on that leg. That's a very clear-cut, obvious primary lameness. So a primary lameness will exist with no relevance at all to any other lameness or problems in the body. Secondary lameness manifests itself as a consequence to an abnormal gait or any issues somewhere else in the body, and then that becomes lame as a consequence to the primary cause. So, first and foremost, primary lamenesses require quick attention, proper attention, vet treatment and diagnosis. Here we want to avoid the secondary lameness as well, but also getting onto these primary lamenesses very quickly becomes very important when you can see how they can escalate. If your horse has a primary lameness and this event is treated, your horse is then going to make a full 100% recovery from that primary lameness. So this is where secondary lamenesses get a little bit more tricky. Sometimes the secondary lameness becomes more apparent or is more obvious than actually the primary lameness or the primary cause. Sometimes we don't even need to treat the secondary lameness once we've identified the primary cause and the primary lameness. Sometimes fixing the primary lameness will make the other just disappear. Sometimes, depending on how long it has gone on for or how severe, the secondary lameness may in itself need treatment also. But the biggest rule is to treat the primary lameness first. Anybody who's had me come out to see their horses will know that I will very rarely treat a shoulder, back, neck, etc. without wondering why that has occurred. There's normally a reason why it has occurred, and if we do not remove the reason, maybe muscle weakness, it may be saddle fit, it may be veterinary bone changes that need a vet to diagnose in lower legs. But if this secondary lameness keeps reappearing, it's likely you're just treating a secondary lameness and not the primary cause. So we really need to get to the primary cause first, the primary lameness, and treat that. Some important points to make about this before I close this video off is that all horses that have an abnormal gait have a primary lameness issue. It just needs to be identified. There's no real correlation between the extremity of pain and the definition of primary or secondary. Limb that looks more in pain is not necessarily the primary cause of the issue. A severe lameness is not necessarily a primary lameness. Quite often, the secondary lameness is actually more visible than the primary cause. The other important thing to know is forelimb lameness is normally secondary to hind limb lameness. And what do I mean by this? If you have a horse that's really obviously overtly lame in a front leg, it's likely that that's the primary. If you have a horse that's severely and obviously lame in a hind leg, then it's quite likely that is the primary. However, if you have equal lameness or equal short stepping from hind to front, and often this occurs in diagonals, it's more likely that the primary issue is in the hind end or the hind legs. And as I've mentioned before, if you have a horse with ongoing sacro issues, which are not an obvious primary tear, etc., back pain, neck pain, any of those kind of ongoing issues are often secondary to something going on lower down in the horse's body. So remember, if it's recurring, we haven't identified the primary cause. So that's point one. Just do a quick recap. Get your slow-mo videos of your horse and follow me along this series so that you can do your own assessments. And secondly, we need to treat that primary cause. And often what we're seeing is a secondary lameness, not a primary lameness. Thanks for listening. Please make sure you subscribe to my channel if you haven't already. Click that notification bell because it's the notification bell that will let you know when I release my next video in this series. So thanks again, and I'll speak to you next week.